realistic, a workable exit strategy?
Well, what's happening now is that China is actually beginning to unlock various sectors. They're unlocking, for example, the heavy industrial sector and the small business sector. And they'll be watching very closely as they do that to see whether or not transmission is increasing because they've undone these sectors. So we have an example for the rest of the world. And the rest of the world will be watching very closely as they do their own risk assessments to see which sectors they might want to unlock first.
So the WHO is saying, watch China, watch what they're doing. This might give us a clue as to what a successful and sensible exit strategy might look like.
That's right. And in addition, they're giving other guidance about what needs to be in place should a country decide to unlock certain sectors. And not only that, but what they would need to be doing to do a risk assessment constantly to make sure that they're not breaching the goal of what they've set, which in most countries is to decrease a surge of patients on hospital beds.
Does it worry you, David? Does it scare you when you hear other governments whose countries are way behind China in this whole cycle, when you hear these governments and businesses suggesting an early end to isolation in the interests of getting economies going again? Does it scare you?
You know, it's a real difficult decision for everybody, including governments and the medical profession, as to how this should proceed. Because the economic clampdown in many ways is harming those who are less fortunate in all societies, the poorer. And at the same time, we're seeing that there are decisions having to be made in places like Italy, where there's been a surge on hospital beds about which patients can be admitted and which cases can't be admitted because there isn't sufficient ventilator equipment to take care of them. So it's a very difficult decision to make.
Do you look with wariness at the numbers coming out of China? Do they, from a scientific perspective, David, make sense when you hear that no new cases are being reported, despite large swathes of the population getting back to work, getting back on airplanes? From a scientific perspective, do these numbers sound right?
Well, right now, what's happening is that China is seeing more cases coming into the country than they're identifying as being cases occurring in the country. They feel that their lockdown has been successful, and that's what they're reporting to the World Health Organization. I have no way of determining whether this is valid or not. The WHO team was there and felt that it is valid, and I think there's no reason not to believe them that this is valid information that's being reported.
You know, I appreciate this is a first in so many ways, and we need to hypothesize a little bit, but could you imagine the exit strategy being this on-off isolation strategy that so many people are talking about? A couple of months isolation, a month off it, or do we need to keep going in as draconian a way as we are now until a vaccine is found?
Well, you know, Axel, the most important part of all of this is for people to understand how they can protect themselves and also protect others. And there are various measures that they can take, and we all know them. Just be careful to physically distance from others, socially distancing, making sure that public gatherings and places where people gather either respect physical distancing or are closed down for a time, and also being sure that if surfaces are touched, which might be contaminated by the virus, that hands are washed. That's a very simple message that all people should understand. And at the same time, people can prevent others from getting infected by wearing a mask if they're coughing or sneezing. Interventions that are very important. And if they become a part of our culture, they can do a lot to beginning to shut this epidemic down, not stop it at this point, but certainly decrease transmission.
Without wanting to draw you too much into the politics, who's doing this right, would you say?
Well, I don't want to say who's doing it right and who's doing it wrong, because everybody is building the same ship as they're moving ahead. But I think that countries that are being able to instill in their populations this protect yourself, protect others philosophy is really a long way. And especially this is occurring in countries that had the SARS outbreaks or who had MERS coronavirus outbreaks. In Singapore, for example, they've encouraged people to continue with their daily lives, continue to work in that, but understanding that they shouldn't gather in large groups. And they've kept their schools open. And they've been able to keep transmission at a very low level by doing that. Other countries, such as South Korea, had two major outbreaks, and they've been able, by public health measures, including testing of people who were contacts of other people that were known to be infected, they've been able to identify them, isolate them, and interrupt chains of transmission, and also decrease their transmission to lower levels. Mm-hmm. So the countries that experienced SARS outbreaks or MERS corona outbreaks in the past seem to be those that are better able to deal with this infection today.
All right. Look, it's the end of March. What, David, if anything, that you've seen or heard over the past few weeks gives you the greatest cause for optimism that we can indeed get this under control?
Well, I think the greatest cause for optimism is the fact that the technical experts from around the world are working together despite geopolitical tensions. And they're working through WHO and bilaterally and multilaterally through other mechanisms. And they're developing the understanding that we need of this new and emerging infection. And there are still a couple things we don't understand completely. We don't understand how easily this transmits from person to person, nor do we understand the full spectrum of disease. We know it's a very serious disease for certain people, but we know that despite that fact, there are others who also develop serious illness. So I think the good news is that technical people are working together around the world, despite the geopolitical tensions that are occurring.
And look, you mentioned that. Let me ask you, and we'll come on to vaccines and the way pharma companies are collaborating in just a moment. But the WHO has said we need political solidarity. Governments, as we all know, are enacting very different strategies at different paces. Are you concerned by a lack of international coordination? My first question. And secondly, are you heartened when you hear, I think it was today or yesterday, President Xi Jinping reaching out to President Trump and saying, look, we are here to help?
You know, what's very important is that countries now can do their own risk assessment based on the same evidence that WHO would have access to. In the past, that wasn't the case. But now countries have access to WHO's views. They have access to medical literature, which is rapidly reviewed, printed online and in front of the paywall. And they have all these international networks working together to understand the outbreak. So countries, whereas in the past countries couldn't do their own risk assessment, they can now do it, and they are doing it. And they're deciding based on their risk assessment which populations are at most risk and how they can best deal with those risks within their own context and their own financial situation. Sorry, go ahead.
No, I was going to ask specifically on China and the US, what you think the best assistance would be. What would be most useful to the US now from China and what they've experienced?
Well, I think the most useful always is technical collaboration. So the Chinese Center for Disease Control and other people working on the outbreak containment and activities should be and are actually in contact through WHO and through other groups with the people in most countries in the world, so that everybody is benefiting from this wealth of knowledge which the Chinese have collected and are sharing globally.
What do you make, David, of this herd immunity that we've heard so much about, particularly in the UK? China, of course, is moving back to normal life without herd immunity. I say moving back to normal life, albeit very, very slowly, but without herd immunity and without a vaccine.
Well, there are two things that are important. Number one, whenever a new or emerging infection appears in humans, we don't know its final destiny. So we don't know the destiny of this virus in human populations as it continues forward. We don't know what will happen. But could you repeat the rest of your question again?
Yeah, I get my feeling was, I wanted to know what you thought about this herd immunity, whether you think it's something we should be serious about. And I say it in the context of China, moving back slowly to normal life without a vaccine, before a vaccine's been developed, and without herd immunity.
Yeah, that's right. So what we don't know is the destiny of this virus. We don't also know what really the immune characteristics that the virus produces are. We know that the virus produces antibody, but we don't know how long that antibody will last, which is what's the basis of herd immunity. We know that in other coronaviruses, immunity lasts for varying periods of time, but not indefinitely. And so people can be reinfected with these coronaviruses that cause the common cold, for example. So we don't know whether immunity from this virus is solid, number one, how long it will last. And number two, herd immunity would mean that almost the entire population would need to be immune by having had disease in order to stop or decrease transmission. So, herd immunity means stopping transmission. Control means decreasing transmission. And right now we're striving just to decrease a surge of patients. So we're a long way from being able to say that we are headed for herd immunity. And the best thing now is to wait and understand what this virus is doing long term. And in the meantime, do everything we can to control transmission.
What is the likelihood, David, of a successful vaccine being developed over the next 18 months to 2 years?
Well, the good news is that there are lots of vaccines under development. And these vaccines, some of them need to go through first studies in animals to see if they're effective. And then after that, studies in humans to see if they're safe and effective. The good news is that recently there has been an animal model that can be infected with this virus that reacts in the same way as humans, and that's a macaque monkey. So now the studies of new vaccines, and there are many of them, as I said, can begin in animal models to see if they're safe and effective in animals, and then they would logically progress to trials in humans. So that's underway. Some vaccines are felt not to require initial trials in animals, and they're going right into humans. And those vaccines are also underway and beginning to be studied for safety in humans. So we're making great advances in development of vaccines, and the regulatory agencies that eventually license these are working with the vaccine developers to see that licensing is not an obstacle. What's important after a vaccine is licensed, though, is production capacity. And the question is, will there be the production capacity in the world necessary to provide a vaccine that's needed for the risk populations around the world, not just in the rich countries?
Yeah, I was going to ask how one would then also prioritize vaccine supply, make it in an equitable and affordable way.
Yeah, it must be made available to populations in need, perhaps to health workers first, or those frontline workers, and then to the elderly, and then others. And it will be a real issue to make sure that there is equity. Fortunately, there's the World Health Organization. There's a group called the Coalition for Epidemic Preparedness Innovations, which is working on vaccines and accessibility. And hopefully we won't run into the problems that we've run into with other vaccines not being available to all countries when they're needed.
And is that because countries nationalize their vaccine supplies, or is this something you fear happening in this situation now?
Well, many countries have laws in place that say vaccine can't be sold internationally until it satisfies domestic markets. Some of those can be bypassed by giving a small portion to, or leaving industry continue to develop a small portion that's in reserve. But there are many issues that have to be resolved, and before vaccine is equitably accessible everywhere. And it's just good to know that there are groups working on that now.
Again, I don't want to draw you as a scientist too much into the politics, but I must ask you whether you think vaccine makers are in some corners being pressured into cutting corners to get vaccines out more quickly. The first part of my question, and the second part is, what corners, if any, are safe to cut in an outbreak like this?
Well, what will happen is that there will likely be an emergency license provided to these vaccines, which permits them to be used after they've been shown to be safe in humans and effective and to a certain extent. That license will be permitting them to be used and looking more at what happens after vaccination than what happens during vaccination. So there are measures in place that will do that. And there are also vaccine manufacturers who have agreed to work together to try to share their data and arrive at a vaccine more rapidly. Certainly, there will be attempts to cut corners by some groups, but I think in general, our regulatory agencies are robust enough to make sure that what vaccines are developed are safe and effective.
Even if we have to cut corners doing it, I guess the question is, what corners are safe to cut in an outbreak like this, and what corners are not safe to cut? Are any corners safe to cut?
Well, the good news is that the regulatory agencies are working with the vaccine manufacturers and developers now to determine what corners may be cut or what shortcuts may be possible, as long as they're ensuring safety and effectiveness of the vaccines. So there will be some decisions made as to what corners can be cut or how things can be done more rapidly.
You mentioned being heartened by the way the technicians are working together. Leaving the politicians aside, we've looked at that. But what about the and you mentioned the pharmaceutical companies? Are you sensing a change? Are you sensing a coming together at this time of need, a partnership, a level of partnership and collaboration that we've not seen before?
Yes, I think we began to see that in the SARS outbreak when people were freely sharing information. And we're seeing that again. And now we have an ally in these medical journals, the major medical journals in the world, doing rapid peer review of scientific articles from China, from everywhere else, and putting that rapidly on the web in front of their paywalls. That's unheard of before. This is the way that academics can get their credit for having published, and also how the public health community can actually now understand what's going on and get rapid answers to the questions that remain.
Word is that there's been little, if any, nagging from pharma companies along the lines of who's going to get the credit, how do we get paid? Are you getting that sense as well? And let's face it, it's an industry, a sector in need of some better PR. Maybe this is the opportunity, no?
Well, it could be. And there's also this group called the Coalition on Epidemic Preparedness and Innovation, which is providing public and private sector, public monies to private sector to do the work. This alliance has been heavily funded by the United Kingdom, by the Bill and Melinda Gates Foundation, by the Norwegian government, and by the Wellcome Trust. And that's providing millions of dollars to small biotechs and companies that have an interest in developing a vaccine. So the public sector is really taking the risk for the private sector and letting the private sector move ahead with its research and development.
Mm. David, you've spent much of your professional life working in this field, studying not only disease, but humans' responses physically and mentally to this. And I mentioned SARS at the top. Does the how should I put it? Does the collective trauma that we're all experience surprise you? And how positive are you that, again, we can collectively push our way through this?
Well, Axel, I guess everybody is surprised at the extent of what's happening in the world because of a little virus, which is causing so much distress and so much illness, especially in the elderly. So the world is experiencing something which it's not experienced before in the 21st century or in the 20th century, except possibly during wars. And there's a great mobilization going on to get countries to work together and to share data and to be sure that we can overcome this challenge. The world will be changed after this. I think there's no question that we're learning new ways of working together. We're learning of ways that we can share information very rapidly. And hopefully this world that occurs after this experience will be a better world, which has more equitable sharing of any goods that are needed so that the world together can advance rather than only certain parts of that world.
Mm-hmm. Do you think, though, that we are, and it's a tough one, but we are mentally prepared for something like this?
Certainly, we weren't mentally prepared. I myself was certainly not mentally prepared to see what's going on. And it's really quite surrealistic many times to see the different activities that different governments have chosen to do in order to stop progression of this virus, in order to protect their health systems. If we had learned from past outbreaks that we have to have a surge capacity in health systems, that we have to have the ventilators that might be necessary, we'd be facing this outbreak in a much different way. Instead of putting the trillions of dollars that we're doing now into stabilizing the economy, we could have put in millions of dollars or billions of dollars in the preceding times to shore up our health systems and make sure that we could deal with outbreaks such as this. We're learning as we go along.
Yeah. So I guess the positives in some way are what this from here on out will mean in terms of resilience planning, spending on virology and epidemiology to prevent future pandemics, helping us understand what makes societies more resilient to pandemics. The positive is that we need to put these things in place, and we need to do it now.
Absolutely. And we need to not, when this outbreak comes to an end or when we have best controlled this outbreak, we need to then not let the funding dry up, which happens after many other outbreaks. For example, during the SARS outbreak, there were vaccines being developed. There were studies to identify why markets were at great risk in China. All this research dried up after the outbreak was contained because there was no longer government commitment to doing it or private sector commitment. We have to make sure that that doesn't happen again.
Does the crisis underline the importance and the relevance of the World Health Organization, or do you think it highlights just how underfunded, undervalued, underutilized, some would say it's been over the past decades?
Well, I think the World Health Organization is doing a tremendous job in collecting information and making that information available to countries, and also in providing guidelines. WHO no longer, as I said earlier, needs to be doing a global risk assessment and telling countries, here's what to do, because countries have the means to do that themselves now. Countries that don't have that means will depend on WHO to help them. But that information is available now to everyone, and everyone should be now taking it, doing their own risk assessments. Every country, that is, should be taking that information, doing their risk assessments and designing their control measures based on the technical guidance that has been provided by WHO.
Look, David, we've only got a few minutes left, and I've got a couple of final bits and pieces. And one of them, and having spoken to a number of colleagues, friends, doctors, what is your thesis on where this originated? What are your thoughts on this? We read so much about it. There's so much information out there. There's so much conflicting information. What does David Heymann feel?
Well, this virus clearly resembles very closely, almost 99.9%, a virus that's carried by bats. And bats have a unique capacity to carry many different viruses, including the Ebola virus, without getting sick. Somehow, bats were able to infect one or a few humans, either by infecting an animal which was being sold in an animal market and was then butchered by the people who bought it. They became infected, or some other way. But it seems that this origin is in the animal kingdom, as have been most other infectious diseases in the past. AIDS has come from the animal community. Also, we've seen influenza. Seasonal influenza has come from wild waterfowl that then have their viruses breach the barrier and infect humans, and some of them establish residence in humans and become endemic, as did HIV from the animal kingdom. And we also see tuberculosis and other infections that we know very well that at one time did the same thing. So it's pretty clear that this virus has come from the animal kingdom. It's infected humans, and somehow there was a major explosive event in Wuhan sometime in December or January, which set off many, many different chains of transmission that caused a major outbreak at a time when people were very mobile in China.
I believe you're in France right now as we speak. It's a country that is being hit hard by this right now. Is it unfair of me to ask you whether there's any hope to feel cautiously optimistic as we move forward?
Well, I think that what we've seen is that countries have learned a lesson from Italy. Unfortunately, Italy was not able to accommodate all the patients that they've had, and they had a high mortality rate. They also have an elderly population, which is at greater risk, and some of those people had comorbidities, diabetes, etc. And so the result was that they had a surge of patients that they couldn't manage. And some of them had to not be admitted to hospital. So other countries in Europe have taken this to heed, and they've done very draconian measures in some instances to try to stop a surge on their hospitals. And countries like Germany, the United Kingdom, France, other countries seem to be having had an effect on decreasing that surge of populations. But what's not understood at present is what will happen in the future, what will happen as countries begin to unlock some of these measures, and they must watch closely, as we all must, to make sure that unlocking doesn't cause another surge in patients.
And that brings us nicely, actually, full circle to where we started. The very much the newsy part of this discussion. You had just got off a call, a strategy call with the World Health Organization. The talk now is of exit strategies. So it's moved on from dealing with the situation right now. Are we getting to the exit strategy bit too late? Should we have started talking about that far sooner?
Well, it's always a good idea to have an exit strategy when you go into something and lock down. And most countries didn't have an exit strategy. And so now they'll be looking how they can begin to exit, but at the same time not cause a surge of patients or an increase in transmission. And that's a very tough thing to do. But countries, by doing systematic assessment of the risks of various populations, aided by a new antibody test, which is coming soon into use, and which will tell who's been infected in the past and where there's most activity and transmission, all these findings will help countries determine how they can best unlock and begin to transition into a strategy which they hope, we can all hope, will be sustainable in the long term.
David, it's amazing how quickly 30 minutes goes by. I want to thank you very much. You know, we stood here across the UK last night, I should say. I don't want to date this piece too much, and we applauded the National Health Service. I want to thank you as well for everything that you do in this fight, and thank you very much indeed for your time with us today. David Heymann, thank you very much indeed.
Thanks very much, Axel.